Horizontal bite wings achieve precision in every shot. Horizontal bite wings are one of the most routine and important x-rays that we take, so it's so important that we do these accurately every time.
For adult patients, we recommend using the Jazz Solo sensor. This is the larger of the two sensors and offers the image area of a size 2 sensor with the comfort of a size 1.
Remember to be mindful of the angle that the cord comes out of the sensor to avoid having the patient bite down directly onto it.
Remember, the goal of a horizontal bite wing is to see the top part or crown of the upper and lower teeth evenly, have the interproximal or in between the teeth spaces open, and to see the bone levels of both the top and bottom teeth. For horizontal bite wings, you want to use the red easy positioner that goes side to side, not the one that goes up and down. The up and down one is for the vertical bite wings that we will review next.
We recommend using the Jazz holder when taking horizontal bite wings to keep your sensor in place and prevent any accidental movement that could cause a compromised image.
You can also use sticky tabs if your office uses those, however you may run into alignment issues with your x-ray generator without the holder and positioning rings. If you're using the sticky tabs, this is where to place it on the sensor. You want it to be exactly in the middle so that you can see the top and bottom teeth evenly. We also recommend using a sensor shield to keep the sensor protected if you aren't using the positioners. When aligning for horizontal bite wings, you want to place the sensor in the mouth between the tongue and the teeth. Ask the patient to close slowly on the positioner or sticky tabs so that the sensor is placed evenly between the upper and lower jaws. Next, position the front of the x-ray tube so it's lined up to be as parallel as possible with the sensor so that the x-ray beam can go exactly perpendicular to the sensor. This is where the holders and positioning rings can be a big help. For most adults, you'll take 4 bite wings to see everything that you need to see, 1 molar and 1 premolar bite wing on each side of the mouth. If the patient has their wisdom teeth in or they're missing teeth, you may need to take fewer or more x-rays. For the molar bite wing on each side, we want the sensor to be positioned so that we can see the very back, or what we call the distal, of the last molar in the mouth, all the way up to the distal or backside of the last premolar.
To do this, you'll need to position the sensor as far back in the mouth as you can. Ask the patient not to bite hard on the cable, particularly when sticky tabs are used to prevent damage.
For the premolar bite wing, we'll move the sensor toward the front of the mouth so that you can see the very back of the last premolar all the way up to the distal or backside of the canine.